Liraglutide can maintain glycemic control in the patients with type 2 diabetes mellitus. Most of the patients with type 2 diabetes are prescribed metformin or insulin injections to meet the glycemic control, as maintaining glycemic control is essential in preventing the complications. Basal insulin treatment is associated with weight gain and increased risk of hypoglycemia. Multiple daily insulin injections generally result in even greater weight gain and insulin resistance. Even with these side effects, the patient may not be able to reach adequate glycemic control. Therefore, adjuvant therapy using novel glucose-lowering agents should be evaluated to determine the efficacy of preventing the risk of these side effects, including glycemic control. The objective of the present study was to study the effects of the liraglutide on glycemic control in type 2 diabetes patients treated with multiple daily insulin injections, and to test the efficacy of liraglutide on weight of these patients. The present study design was a randomized, double-blind, placebo-controlled trial with a parallel group design. The sample size taken in the study was 124 patients, in which 64 patients were administered liraglutide, and 60 were administered placebo. Liraglutide or placebo was administered at a dose of 0.6 mg during first week, 1.2 mg during second week and 1.8 mg during week 3 onwards. The patients should take the drug same time each day during the trial. The dose increase was extended based on the individual's tolerance to the trial product. The study included type 2 diabetes patients treated with multiple insulin injections, glycated hemoglobin concentrations greater than or equal to 7.5% and less than or equal to 11.5%, and body mass index of 27.5 to 45 kilograms per meter square. The exclusion criteria includes patients taking premixed insulin and patients with chronic conditions like cardiovascular disease. After a maximum run-in period of 8 weeks, the patients were randomized in 1:1 ratio to either subcutaneous liraglutide or placebo. Masked continuous glucose monitoring was carried out using Dexcom G4 Platinum glucose monitoring system. After randomization, follow-up visits took place at weeks 6, 12, 18, and 24 for examination. The glucose levels were evaluated during first and 12th week of the trial, and during first and second week of follow-up period of 24 weeks. Capillary glucose levels were evaluated before and after meals, during the trial and at the end of follow-up. Insulin doses, adverse events, hypoglycemic events, and blood pressure were checked during the follow-up. The results showed that HbA1c concentration was reduced by 1.54% and 42.9% in liraglutide and placebo group respectively. Most of the patients had HbA1c concentration less than 7% in liraglutide group when compared to placebo group. The total daily basal insulin was reduced by 6.8 units in liraglutide group and 0.5 units in placebo group. The total daily mealtime insulin dose was reduced by 11.2 units and 1.9 units in liraglutide and placebo groups respectively. There was no hypoglycemic events in both the groups. Body weight was reduced by 3.8 kilograms in patients treated with liraglutide, and there was no weight reduction in patients treated with placebo. Gastrointestinal symptoms were observed in both the groups at the start of the trial. The overall adverse events experienced was 4.7% in liraglutide group and 6.7% in placebo group. The study had been conducted to know the effects of liraglutide on glycemic control in patients with type 2 diabetes. It had been proved that the liraglutide improves the glycemic control in type 2 diabetes patients treated with multiple daily insulin injections and long duration of disease. It is also associated with reduction in body weight and insulin doses.